Good morning, my skincare geeks. We're back, and today we're going to talk about dry, cracked feet. You know why? Because recently I was in bed and my feet were rubbing up against each other, and I was like, what the heck is going on? Those can't possibly be my feet. And I took a look, and unfortunately they were. And I'm not having it. I need my baby soft feet back, and I want to help you get yours back too. I'm Dr. Hannah Kopelman. I love sharing my skincare knowledge with you, and I love sharing everything I know so that I can help you have glowing skin. So today, let's get into it. We'll talk about causes of dry, cracked feet and how to remedy this problem. Let's talk about dry, cracked feet and stinky feet. Yes, stinky feet. There are 3 common causes of dry, cracked feet. Can you guess what the number 1 cause is? It's walking around your house completely barefoot. No shoes, no slippers, and no socks. When you walk around your house without any protection on your feet, you're exposing your skin to different surfaces, trauma potentially, and dry air. And eventually, the skin on your feet will get actually thicker and can potentially form cracks or fissures or calluses. So the best thing to do to avoid that is wear socks. Next up, and very commonly I see this in patients, is wearing flip-flops or sandals all the time. If you're doing this, again, you're exposing your feet to a dry environment and environmental factors, so your feet are not retaining any moisture. So I definitely recommend trying to alternate the shoes that you choose, or if you're going to wear flip-flops frequently, then we're going to get into some tips of what you could do to moisten up your feet. And lastly, if you have a job that requires you to stand on your feet all day long, which I do that too, you want to make sure you're wearing very supportive footwear that have good arches, because a lot of times I see people with dry, cracked feet who are wearing totally flat shoes that do not have arch support, and it's causing a trauma to their feet. So I do want to put it out there that I believe that soft feet, as well as many other things in skincare, are genetic and hereditary. My grandmother, for example, is 97 years old, or she's almost 97, so let's not rush it. She's 96 and a half. But I recently took her to the podiatrist, and the podiatrist said she has the softest feet of any patient they've ever treated. And they asked me, do I moisturize? And I do, but not so often. I really believe that her soft feet are both genetic and hereditary. Like, I believe that her parents had soft feet. But I also think it's because of the habits she had. And that was, she always wears slippers when she's in the house for as long as I can remember. And then when she goes out, she always has socks and shoes on, and very infrequently does she wear flip-flops or sandals. So her feet are not often exposed to dry environments, and they are kept moist. So I like to think that that's why she also has soft feet. So I must say that I used to have the softest baby feet, and now recently I've noticed them getting dry. And I believe that this is for a few reasons. One is it's cold out, so it's dry, and there's very little humidity in the environment. So again, my feet are getting that dryness, and they're not getting enough moisture. And I also am guilty of lately walking around my house without socks, shoes, or even slippers on, completely barefoot, which I really shouldn't do. And I also believe that I have not been as good as I should be at moisturizing. I also want to mention that there are medical conditions that can contribute to having dry, cracked feet, like eczema or psoriasis, or even a fungal infection known as tinea pedis, or even thyroid disorders. I've also seen dry, cracked feet in people, women specifically, who are postmenopausal undergoing hormonal changes. So how do we get our soft feet back? You want to use products that contain ingredients like lactic acid, glycolic acid, urea, salicylic acid, anything that is a keratolytic, because this helps break down the outer layer of skin, which is those dead skin cells, and it helps soften your skin up. So let me go through my routine for soft baby feet. Okay, so the first thing I do is I run a lukewarm bath and I soak my feet in it for about 10 to 15 minutes. It's important not to use hot water because that will strip your skin of more moisture. And typically when I'm doing this, I don't use any soap, but if I were to use soap, I would just pick a gentle one that is fragrance free. You want to make sure it's fragrance free and also gentle because otherwise it can contain alcohols in it, which also could strip your skin of more moisture, which is the last thing you want to do here. So now you get out of the bath and your feet are nice and soft. You've softened out that outer layer of skin. And this is the best time to apply a moisturizer because it can penetrate deeper when your skin is wet. So lately, I've been really enjoying using this and I think it's working really well. The amlactin, it has 15% lactic acid. This is the intensive healing one. They also make a daily one, which has a 10% lactic acid. So I think if you are worried about dry, cracked feet, choose the one that has a higher percentage unless you can't tolerate it. So once you've put a nice layer of this on your feet, I then seal in that moisture with Vaseline. You can also use Aquaphor. They make a great spray bottle that can just spray right on your feet. It's really easy to apply. And then once I'm done putting this on, which sometimes people don't like it because it's very greasy and I get that. So typically I do this part at night and not so much in the morning. I then immediately put on my cotton socks and I get into bed. So I do like applying this twice a day, but again, I typically skip the step of Vaseline because it's just a little too greasy if I'm about to run off to work. So that is what I've been doing lately, and I have been noticing an improvement. And there are 3 other products I really like. One is by Eucerin. It's the Roughness Relief Spot Treatment. It contains urea in it, so it helps draw in water and that moisture. It traps it in, and it also helps peel away the dead skin. I also like the Isden Urea Foot Oil, and I also find that the CeraVe SA Foot Cream does good things as well because it helps exfoliate that outer layer of skin. So I don't want you to get overwhelmed by all the product ingredients I mentioned because there is something that has gone viral, which is the baby foot mask. And I want to show you a little clip of what I saw on TikTok.
How I got my feet from this to this in less than 7 days. I use this foot mask that I got from Amazon. I've linked it in my bio for all my girlies. And I started off with scrubbing the life out of my feet. They look like little socks and you just put them onto your feet. It already comes with tape. However, I used extra tape in order to make sure that no liquid was going to come out in any which way, shape, or form. And I just secured them onto my feet. I think adding socks is the game changer. I added my socks and I sat in it for about an hour 30. Afterwards, I rinsed them off in this water and they were feeling quite smooth and quite soft already. And this was like day 1. This is day 3 and you can already see the difference. My feet were going through it, but you can already see that baby smooth skin coming in, honey. Like, it's a difference. It's honestly a game changer. It is summertime, so our feet are about to be out and about.
So as you could see, she has dramatic and drastic results from these baby peels. And it kind of is crazy. Your skin peels off like a grated cheese or like snake skin. And that's because essentially these feet masks are like chemical peels for your feet skin. And while obviously they do work, you have to be extremely careful. I'm a little bit wary about using them because they contain several ingredients. So all the products I mentioned today, most of them just have like 1 or 2 keratolytics. Like one has salicylic acid and urea, or one has lactic acid and urea, but they don't all have like 10 of them. And I think that there are just a few too many ingredients being used in this product that could be very irritating for your skin, especially if you're someone with sensitive skin. I would definitely avoid this. And also if you have warts or calluses or infections on your feet, I would also avoid it. If you leave this product on for too long, which I think has happened, I've seen this in patients that they kind of just forget about it, or they're watching TV and they just like keep it going because they think the longer they keep it on their feet, the softer their feet will get. But that can actually cause chemical burn. So you want to be extremely careful. Also, if you are someone that enjoys using a pumice stone, which sometimes when you go get a pedicure, they use this, You want to make sure that they're only using a mild to moderate pressure on your feet to get off that dry skin or that callus, because that can be extremely irritating for your skin as well. If you're starting to form calluses on your feet, I recommend a product called Carousel. It contains 3 ingredients: urea, salicylic acid, and petroleum. So it's both exfoliating and helps soften up the skin on your feet. Now, if you're starting to form cracks or fissures on your feet, I recommend using something like Crazy Glue because that could help seal those cracks, but I would not overdo it because eventually you may form blisters in this area. Okay, so now that we've covered dry, cracked feet, let's talk about stinky feet. So, believe it or not, the highest concentration of sweat glands on your body are on your palms and your soles. So, if you're someone who sweats and you wear socks or occlusive footwear, then obviously that's a humid, sweaty environment. And this is an environment where bacteria love to grow and they eat the dead skin cells that are around your feet and they release a fuel, and that fuel is what gives that smelly odor. So, what do we do to get rid of this? A few things. One is I recommend using an antiperspirant if you're getting very sweaty feet, something that contains aluminum chloride in it. And the best time to put this on is at night. So you can rub that aluminum chloride deodorant all over your feet, including between the toes, and then go to bed, and then the next day it should prevent your feet from being as sweaty. Sometimes people can't tolerate it as well under their armpits, but I find that typically people can tolerate it better on their feet because your skin is thicker. One of my recommendations for an antiperspirant for your feet is Certain Dry Clinical. I think that you'll find that you'll really reduce your sweating with this product. Now, if you're focused just on the odor of your feet, I recommend using benzoyl peroxide wash. So you could try either the Penoxyl 4% or the CeraVe. And when you're in the shower, really scrub your feet with this and get in between your toes as well. Leave it on your feet for a few minutes to make sure that the ingredients really penetrate into your skin. This will reduce the moisture on your feet and also reduce the bacterial load, so it will make it less stinky. Another product I really like, which is a deodorant, is the Lume Cream. I find that both of these help reduce odor and people find them not irritating. So there you have it, my skincare geeks. I hope I get you feet that smell like flowers and that are as soft as a baby's bottom. If you have any questions, leave them in the comments below. If there are products that you like that I didn't mention, please share them. I would love to know myself, and I will see you soon in the next video.